Good afternoon and welcome to the Federal Executive Forum celebrating 18 years of profiling excellence in government IT mission programs. I'm Luke McCormack. During today's show, we will discuss critical issues facing government and industry leaders and using information technology to improve healthcare and healthcare services. With me on today's show are Ms. Ryan Argentieri, Deputy Director, Office of Technology at the Office of the National Coordinator. Mr. Carl Mathias, Chief Information Officer, Health and Human Services. Dr. Neil Evans, Acting Program Executive Director, Electronic Health Record Modernization, Department of Veterans Affairs. Gary Lynch, Global Practice Lead, Healthcare and Life Sciences, Verizon. Frank Johnson, Vice President, Federal at Lookout, and Ben Cushing, Chief Architect, Health and Life Sciences at Red Hat. Well, we're going to start off with you, Ryan, and talk about what is happening at the Office of the National Coordinator. A lot of activity going on there, huge responsibility in the healthcare community. Give us a state of the state.
Thanks so much, Luke. We have had a very busy year at ONC. It has been very transformative and exciting for those who have followed along with the transformation of health information technology over the past 10 years or so. Our new national coordinator, Miki Tripathi, has been in the space for a long time. So it's been really exciting to see how the foundation that's been built by some of our partners here and many of those listening over the past decade to lay the infrastructure for health information technology and data exchange. We're now building on top of that pretty aggressively, whether it be partnerships with our existing federal agency team, so CDC, CMS, FDA. I can talk about those examples later, but we have expanded our United States core data for interoperability and our partner program, which is called USCDI Plus, to do a better job of reinforcing data quality at that foundation. We've launched and really exciting, I think, for a lot of people at the department, the Trusted Exchange Framework and Common Agreement, otherwise known as TEFCA, which addresses networks and how the data fabric across the country is really going to innovate, and the public-private partnerships that were established in part during the high-tech era, and seeing how we can really continue to leverage and innovate off of what the private sector is doing and increasingly what people like but Carl are doing elsewhere in HHS to make sure that we are really taking advantage of technology and innovation for the American public and improving patient care. And then the last thing I'll mention is our one of our new proposed rules, which is HTI-1 for short. And what's most exciting about this, in addition to just continuing to refine and enhance what the capabilities of certified health IT products should and can be doing, both for patients, providers, and others in the healthcare ecosystem, it has done a lot to address artificial intelligence and the use of decision support intervention tools in a transparent, safe, and fair manner. So those are probably the top three accomplishments. We've done a lot more, but I'll stop there. Thanks.
And that's a lot, and such a tectonic shift in the use of technology and such a key role the National Coordinator Office plays in that. So thank you very much for everything you're doing. Of course, ONC, part of HHS, along with FDA and NIH and Indian Health and CDC and a whole bunch of activity that goes on. Carl, you've been over there at HHS now for, I think, about a year and a half, almost, a year and change. Tell us what's cooking over there in regards to your top line activities.
Yeah, it's been interesting. Yeah, coming up on a year and a half. And I think I don't know that I said it last year when I was on the panel here with you and Tom Trezza and everybody, but I came on talking about data, and I'm going to tell you nothing has changed in that respect since I got here. You're going to hear me talk a lot about the data.
Sure.
So let me give you a few things that have been going on there that are exciting in that area that are going to make us deliver better healthcare. For one example, we've developed a framework for expediting data sharing between the Department of Health and Human Services and the VA In May of 2023, we assigned an agreement with the Department of Veteran Affairs so that we can share data with them, basic terms and conditions. We set this up so that we could protect that data. We could use data that's non-public. This has been normally a very complicated, extended process for when we want to share information. Well, we've created this framework now where we can expedite that to make sure that we can share public health data, patient care data, health care quality information, assistance, surveillance, analysis, prediction, response to existing emerging health concerns, things like that in a more agile way. So right now we have, using this framework, the CDC is working with Veterans Affairs on that, but we're looking to add other organizations to it over time so that we can continue that expedited ability to share data. We only need to look back a couple of years to the COVID crisis to understand why that agility is needed. So that's the good news. We're really moving forward on our ability within the government to share data, and that's happened within the last few months. There's also another capability we put out in terms of data is, and this is not a new one, it's been there for a while, but it's not well known. But if you go to healthdata.gov, that's the official site for HHS to share open data with the community. And so we share internally amongst ourselves, our operating divisions like CDC, FDA, National Institutes of Health, but also these are available to the public. And so the reason we make these available are for those hospitals that may need them, researchers who may want them at universities or at other facilities. So sitting out there are 12,000 data sets. It's a well-utilized platform. They've had over 12.5 million visits since the beginning of this year. So it's another asset out there that's available to the public that we keep updated. Related to that, we've also launched an internal capability called HHS Connect. And this is so that internally within HHS, which is a very large department, that we can share data amongst ourselves. So our internal employees can request information and we publish information to it, and we share that information internally because it's such a large amount. That's going to be our go-to catalog for where you can go and say, okay, where is this data located? And it'll literally, thus the name HHS Connect, it connects you to that data source so that you can request it and then use it. So that'll help us amongst ourselves within HHS to be more efficient at using our data.
It's certainly all about the data, right? There's no question that that's a big role. You all have a lot of data there at HHS, and we really applaud you exposing that and making that available to the community and cataloging it so people can find it when they're seeking it as well. Let me ask Dr. Evans to weigh in here. Dr. Evans, you recently now in this new elevated role, acting as the program executive director, and we really appreciate that. And had a lot of key assignments over there at VA, a lot of things going on over there. Give us a state of the state about what's happening with the electronic record modernization effort.
Sure. As you mentioned, there is an awful lot going on at VA. And I guess one of the things that excites me is when we're talking about health information technology in government, what's happening in VA is actually broader across the government. I think you've heard this in the comments here. We've already talked about data sharing. Ryan talked about data sharing with the community, Carl with data sharing in between agencies, HHS and VA. When we talk about the electronic health record modernization project in VA, it's not just actually a VA project. It's about implementing a federal electronic health record, which is now live across and being used by 4 separate cabinet level agencies: the Department of Veterans Affairs, the Department of Homeland Security, the Department of Commerce, and the Department of Defense, all using the same common record. The Department of Defense has nearly completed their implementation. The Coast Guard has fully implemented the record, as has the National Oceanic and Atmospheric Administration and the Department of Commerce. And VA is in the process still of implementing the record, building a common record of, for members of the military all the way through their veterans service. Really an exciting project. But that's, just one piece of what we're doing with regard to health information technology in VA. I'll give you another just quick example. This year, in just a couple months ago, May of 2023, was the 20th anniversary of VA telehealth services in VA. And just to give you an example of the level of engagement that we're seeing still with telehealth as we've grown over 20 years, 2.3 million veterans took part in over 11 million episodes of care last year with high levels of satisfaction and engagement. And this is even as we've moved to this point, early in the pandemic, we had incredibly high levels of engagement, but we're still doing 180,000 video visits per week across the enterprise, indicating a real sustained demand for technology-enabled care, even here on the backside of the COVID-19 pandemic. So a lot of exciting work, many other areas I can highlight, but I'm sure we'll have time as we move forward.
And I applaud you for all the work that you all are doing with the outreach with the veterans. Yeah, I think I read an article where they surveyed the veterans and said, would you rather come back in and now that you can, et cetera, post-pandemic? And they said, absolutely not. We love the telemedicine. So speaking of telemedicine, we can't do that without connectivity. Verizon, certainly that's the role you all play, along with many other aspects here. Gary, give us a top line of what you all are doing in the healthcare and life sciences at Verizon.
Yeah, thanks, Luke. As I'm looking across our virtual room here, I'm thinking about the phrase, if you're the smartest person in the room, you're in the wrong room. So I feel like I'm in the right room today. So thanks for letting us be a part of this. Wow, that's geez, where do I go with that? I mean, we're doing so much across the healthcare and life science. We're in a position where we can enable a lot of amazing things that are happening. The VA was an exciting customer. They were one of the early adopters, if you will, of 5G. We've been doing a lot of work with them around, augmented reality in the surgical rooms. I mean, imagine a physician being able to put on a pair of HoloLens glasses, and then we overlay all this three-dimensional high-fidelity images, on the patient, so that the surgeon can see where the tumor is, guide his or her incision, to be able to use AI-enabled gloves to pull out a digital twin of the spine, rotate it. And you think about from like a medical education perspective, to be able to pull a heart out, expand it, walk inside it and look around. It's really some amazing things, and very fortunate that we can, if you look across like all our innovation labs, which we have innovation labs across the globe, right? And so my team, we're really focused on innovation at Verizon when it comes to healthcare and life science. So we're fortunate that we get to work with our customers, our partner ecosystem, and lay down this infrastructure and all these labs, and then bring all the constituents within healthcare together, the medical device, the retail RX, payers, providers, and on down the list. And we talk about problems and we figure out how we can work together to solve these problems. So a lot of really amazing things when you think about the connected hospital of the future, right? It's kind of evolved into more of this connected ecosystem. And we just made a big announcement with the Cleveland Clinic, so I can officially say their name. But this is going to be, we're partnered with them. This is going to be the first hospital built in the country from the ground up with a 5G private wireless network. And that's super exciting for lots of reasons when you think about everything from security to, enable all these amazing things, like I mentioned, AR, VR in the surgical room. But just with I think it was Carl that was talking about data, right? We have massive amounts of data in healthcare. And you think about like precision medicine. I mean, how do you query all this encrypted, data, right? And it was maybe 12 years ago or so, the light bulb kind of went off for me, and I started thinking about, okay, the telecoms of the world are going to play a big part of the future of healthcare, because when you start looking at massive amounts of data, well, that's going to suck up a bandwidth in a hospital, right? When you're talking about AR, VR in the surgical room, you need to have very low latency, right? You can't have a delay when you're cutting into a patient. So I guess the light bulb kind of went off when I was thinking about precision medicine, to make sense of that data, to put AI models on top of that, to be able to query that, to change that data to actionable insights. You need the right infrastructure. So that's a lot of the focus that we have here at Verizon.
Fantastic. A lot of this advanced technology allowing some of these advanced capabilities to happen. And that's fascinating. We really appreciate it. Very exciting as well. Frank Johnson at Lookout. Tell us sort of where does Lookout fit into the healthcare space? How do they unlock these capabilities?
Thank you very much for having me today, Luke. And by the way, Gary stole my line about being the smartest guy in the room. It's a privilege and an honor to be here. Recently attended a government security conference, well attended by a number of executives from information technology, from representing the federal health segment. And there's a lot of concern around, the world's most popular information access device, carried by everybody in and out of private networks, public networks, pulling down personal health information. And we're incredibly focused on doing what we can to protect that device across an ever-expanding attack surface in the healthcare industry. We recently published a global mobile phishing report. Now, why phishing? The information technology suppliers have done a good job about locking down hardware and backdoors and making it harder for cyber criminals to brute force their way in. So they've turned their attention to phishing. And with readily available tools, artificial intelligence tools like ChatGPT and other large language modeling capabilities, it's very easy for a non-English speaking person to be able to mimic your voice and target an individual saying, oh, your child's been in a horrific accident, or using the voice of the child or person themselves. Please click this link, supply money, give us your credentials. And in this global mobile phishing report that we recently published, highly regulated industries are most often targeted. Number one's insurance, which includes health insurance.
Mm-hmm.
In the top 5 is healthcare. So it's a ever expanding, rapidly accelerating area of attack, and we're incredibly focused on protecting that in healthcare, among other things.
Very key aspect as we start to unlock this capability, make it available to the public. A lot of data being transmitted back and forth. Need to button it down, make sure it's all secure, et cetera, with all these various types of technology that Lookout certainly provides. We really do appreciate that. We're going to take a short break and we'll be right back. You're listening to the Federal Executive Forum on Federal News Network. Welcome back to the Federal Executive Forum on Federal News Network. We are talking about healthcare services. And we're going to go over to you, Ben, and talk about healthcare and life sciences at Red Hat. And how do you fit into this role? And just give us a top line status to what Red Hat is doing to enable these agencies to perform their missions.
Yeah, thank you. So Red Hat's the world's largest open source software company. And because of that, we are in just about every single healthcare system you could imagine at some level. If you deconstruct the systems and pull apart the software, you will find Red Hat's bits and bytes in there somewhere. Just sort of the nature of the open source community. Our role in that community, of course, is to continue to foster that software and make sure the open source community is vibrant and continually growing and has real business value on top of its actual inherent value. And what does that mean for actual health and life sciences? So I'll start with the security aspect. We kind of talked about this already a little bit, but Red Hat's fully engaged in this zero trust future. We've been following zero trust principles in our software for probably 2 decades. But the way you actually configure everything requires adherence to pillars of the zero trust. And so we're doing our best to make everyone in the larger community aware of that, to make sure that security is top of mind, and adhering to executive orders around zero trust, which frankly is not just a value on its own as an executive order, but also it has true strength for a security posture for any organization. And then outside of that, we have really begun to create a world of ubiquity of platforms. So, there's multiple cloud hosts. There's also on-prem, there's also edge computing. And what this represents is a whole series of different nodes all over the world where you need to deliver systems for the actual care that patients might receive. And we've sort of unified all those systems using Kubernetes, which is really the new operating system of the cloud. And what this really means for everyone here is when we have a machine learning model, okay, that we maybe develop at the VA, and there's an example of this, or I was a participant in Mission Daybreak, where we were producing machine learning models for the prevention of veteran suicide. Those models, as they're developed within one platform, can be served to any number of platforms across the world in any number of different systems. It's not bound to the system at VA. And this is a incredible future where we're able to take machine learning models that might have been developed from the Mayo Clinic or developed from Intermountain Healthcare or the Cleveland Clinic and bring those to the VA and bring those solutions from the VA out and share the code. I mean, ultimately, a machine learning model is code, and we want to be able to deliver that just about anywhere so that everyone can benefit from it, given the proper policy and IP is protected and so on. That future is right now. It's happening today, and it's a very exciting development. And I'd also say that in parallel, the same thing is happening with the automation of healthcare. So process models are being developed to represent clinical care pathways. And those process models are being written with standards that allow those models to be moved across multiple systems. So for instance, the Mayo Clinic might produce the best clinical care pathway for chronic kidney disease. And they model that, in standards. And that model we can lift it up and actually bring it to the VA, and it will work just as well, and vice versa. That's happening right now, actually between Mayo Clinic and VA. And what makes all this possible is this underlying infrastructure of open source platforms and the adoption of standards, which allows us to interoperate not just the data itself, but the actionable models themselves. So it's a whole nother level of, when we talk about interoperability, it's a whole nother dimension that really gets lost in the shuffle around trying to get the data to be harmonized.
Sure, the future is now, and we really appreciate Red Hat helping to sort of unlock that capability. Speaking of data, Carl, I'm going to jump back up to you. You talked about a framework. You talked about it is about the data. Would you like to highlight a specific program that you all are working on at this point to enable this capability you're describing?
Sure, Luke. I'll start by saying, Carl Mathias is the Chief Information Officer. I am not a practitioner in the medical community, nor am I a researcher.
Mm-hmm.
But as the CIO and my staff, what we see it as our job to enable the practitioners and the researchers to do their mission. So the program I'd highlight as part of that is one I mentioned previously, which is healthdata.gov. That's the official open data platform that we use for disseminating our open data sets that come from the CDC, FDA, NIH, and make that available to the public. As I mentioned before, right now we have 12,000 publicly available data sets on that platform. I mentioned we've had over 12.5 million visits on that since early January. And if you look at the last fiscal year, we've actually seen the growth here in fiscal year 2022. There were 1 million downloads and over 13.3 million assets were accessed out of that. And I did just a brief scan of it again this morning to say, what if you want to know what kind of information's out there, here's just a very small sampling. I mean, you'll see the COVID-19 data of all types, whether it's patient impact, hospital impact, monkeypox research data, kidney care and health equity data, Lyme disease innovation data, cancer incidence information, autism research, chronic disease indicators. So we at HHS, we're continuing to focus on data and make that data available both internally and externally. And healthdata.gov has been an excellent way to do that. And we will continue to support that.
And we really do appreciate that. It's a fascinating capability that you've made available to the public at large. We certainly need to continue to think about securing that data. Frank, I'm going to go to you, and you certainly brought that to our attention. I know that's in Lookout's wheelhouse. That's what you do. Would you like to give us a specific example? You're sort of striped across a variety of agencies and in the private sector. Give us a specific example of where you're enabling this capability in a program.
Well, Luke, I'm going to harken back to the conference I was at recently. It was well attended by a number of IT executives across the federal health arena. And their largest worry is, I'll call it the hyper-connectedness of everything. When you look at a trauma incident as an example, it starts with a call to 911. Those that are following 911 today, it's mostly voice, but with next gen 911, we're quickly moving to text to 911. Rich data types are going to follow, photographs and images and videos. That dispatches responsibilities forward those to EMS then to the ER, clinical setting, to ambulatory, to rehab, to the home. Oh, by the way, the volume and velocity of that data continues to expand. And by the way, as an IT executive, where exactly is the boundary condition of what it is I'm responsible for protecting? Who wants to be a cybersecurity CISO or CIO in the healthcare industry today? It is an absolutely enormous responsibility and opportunity. The punchline that each one of these IT executives continue to make is there's no way we can possibly keep up with this hyper-connectedness of everything. Oh, by the way, I forgot about the researchers. Everybody having access to this data, hopefully safely and securely. Biotech, pharma, and research continue to look for breakthroughs in healthcare. This cannot be achieved without a more aggressive move to cloud technologies. Just can't. And then what kind of issues do those bring to bear and surface, right? It's not just about the handheld accessing the information, but now how do I properly protect these things in the cloud? So the company is incredibly focused on, more secure cloud capabilities, Luke, and, healthcare is a huge part of what we do. So
healthcare, a huge part of very sensitive information. Ryan, I'm going to bring it up to you. You top line some very, very significant national issues that you're working on and coordinating there. Would you like to highlight one program specifically where these activities are enabling the capabilities?
Yeah, there's two really important ones, but I'll start with one with HRSA. So many of you are familiar or may have heard about the UDS reporting program. So if you haven't, this is the process by which the Health Resources Services Administration, or HRSA, has manually captured information from federally qualified health centers across the country to determine how much funding is provided, and to really make sure that the percentage of our population that doesn't always get the best technology or doesn't always get the best access to care, that they make sure that they have the resources made available. During the pandemic, we really have seen across HHS just an increase in, or what I've been calling a convergence between health IT and traditional IT and information technology, and the assessment of requirements that to use and leverage standards like Ben was talking about, which is what ONC is responsible for. So how can we take advantage of fast healthcare interoperability resources, otherwise known as FHIR, to move information out of the manual reporting process and really take advantage of all the innovation in IT itself to help make our federal government more nimble. So in partnership with a number of parties inside HRSA, including the CIO, Adrian Burton, and Jim McCrae from the Bureau of Primary Care, to incredible leaders and champions who've been a part of the government for a long time, we've transformed what that reporting process will look like for the entire country. And that's going to represent a significant reduction in burden for providers and all of the different intermediaries and other companies that are supporting those health centers who often, don't have, and we learned this during the pandemic, they don't have the resources and they don't have, the technical people at the ready, like some of our other colleagues do, to just come in and jump in and fix something. They're, constantly just trying to do the best they can with what they have. So we're really excited and proud of that program. And then the Moving Forward initiative at CDC that many of you know about. There's just a team of incredible leaders over at CDC, from the CIO to a number of others in the organization, who are also championing that, combination of what can we do with standards that help support state and local jurisdictions and transform how we, in a secure way, how we have a surveillance system in place in this country that takes advantage of some of the things that have been done at the VA and DoD and makes them applicable for us at HHS.
I love the sort of this transfer of technology capability across these various communities, and really appreciate the coordination that is happening out of your office. Gary, let's go back to you at Verizon and talk about a specific program that you'd like to highlight, where you're unlocking some of this capability with the technology that you all provide.
Yeah. One of the areas that I get really excited about, in pretty much every conversation I have with anyone with a major health system, we talk a lot about health equity and digital inclusion. And certainly Verizon, we've done a lot around digital inclusion, initially starting out in the education area, and then we've kind of moved that into the healthcare space. So when you think about folks who are making under, $30,000 a year, 42% don't have broadband coverage. 25% of those don't have a cell phone, right? And so those individuals are certainly highlighted during COVID. And so we're really focused around improving access, putting, and I think about, the VA, and I grew up, in naval hospitals, right? Both my parents, they ended their lives in VA hospitals, so spent a lot of time within the system. And I think a lot about, health equity, and if you're familiar with the Affordable Connectivity Program, we have a program around health equity that kind of sits on top of that. So with the government that's offering assistance around broadband coverage, we can actually get those individuals' devices in their hands to help manage their healthcare. So really what we're doing is we're focused on just providing more in-home services, right, through our mobility and our mobile solutions. And I always say, I want to make healthcare proactive, and what we're doing with devices, purpose-built devices, we can load chatbots on those to interact with patients. Hey, how you feeling today? Did you take your medicine this morning? You have a doctor's appointment at 4:00. Can I call you an Uber? And then imagine that patient taking that purpose-built device with them to the hospital. There's geofencing from the medical center that recognizes the patient, welcomes them, tells them where to park or where to get dropped off, wayfinds them to their appointment. Infotainment should the physician be late or whatever, start interacting, filling out forms. So to make healthcare more proactive, those are some of the projects I get really excited about around health equity and digital inclusion.
Very important and very fascinating. We really do appreciate it. Dr. Evans, I'm going to throw it up to you. You talked about some of these capabilities that folks like Verizon perhaps are unlocking. Can you give us a specific example of a program you'd like to highlight?
Sure. I think I can maybe follow on a little bit with one of the examples that Gary just provided. It's really important for us that we are able to connect. I mean, our mission in VA is to fulfill President Lincoln's promise to care for those who've served in our nation's military and for their families, caregivers, and survivors. And that mission applies regardless of where those people are in this country. And what we just talked about is the fact that broadband internet is not universally available. Equity of access is absolutely critical for us. And that it makes me think a little bit about what we call our digital divide efforts. which leverage, Gary just mentioned the Affordable Connectivity Program, the ACP program. We leverage that program. I actually am super proud of the fact that in the VA, at every facility, any clinician can enter in the electronic health record something we call a digital divide consult. I can ask for a consultation from cardiology, from rheumatology, from surgery, or I can also ask for help from the digital divide team. And my veteran is met by a social worker who can get them connected with programs like the FCC's Lifeline program, the Affordable Connectivity Program, or even get them connected to a device that we're able to provide to them to allow them to connect at home if they don't have access to either the device or sufficient internet at home in order to connect back to us, for example, through telehealth. So just last fiscal year, VA completed over 41,000 digital divide consults across the enterprise, and more than 110,000 veterans received a lone tablet from us with internet connectivity to allow them to connect to us for care. And as Gary mentioned, to have that proactive healthcare experience in their home in a way that would not have been possible without that focused attention on the importance of making sure we're delivering these services equitably to all that we're called to serve.
What a fascinating use case, and I really do applaud you for all that you're doing to make that care available to every deserving veteran out there, fulfilling President Lincoln's promise. We're going to take a short break and we'll be right back. You're listening to the Federal Executive Forum on Federal News Network. Welcome back to the Federal Executive Forum on Federal News Network. We are talking about healthcare services. We were just talking about specific programs. Ben, I'm going to ask you to highlight a specific program that Red Hat's been working on to enable this capability.
Yeah, I'm really excited and honored to talk about Mission Daybreak. We were a part of that initiative last year. That was a $20 million grand challenge to reduce veteran suicide. And Red Hat and our team Guidehouse that we were in, we placed in the top 3 for that. It was like 1,400 companies participated in the competition. It was an incredible effort amongst the community to really bring innovative ideas forward. And what's really interesting is, at least for our solution, we highlighted a lot of the things that have come up on this call. So for instance, a big part of our approach focused around health equity and the use of social determinants of health in the actual care of the veterans, in addition to delivering risk profiles to the point of care. And that social determinants of health bit, I think, is probably the most impactful because it impacts the entire veteran population, even those who are not getting care at the VA. And the way that works is because of the way we're tracking and capturing the data, we actually have a way to measure the quality of the programs that are within the communities that the veterans live in. And we can actually provide feedback on whether those programs are working or not. And that can really help guide VA's investment and divestment in those community programs, which of course affect all the veterans, regardless of where they might be getting their care. We use that rich social determinants of health data to also produce the risk profile, along with the electronic health record and social media data, to provide an actual risk score for the patient, for suicide ideation specifically, and then actually provide guidance back to the clinician on what they can do in the next steps. It's one thing just to tell the clinician this patient's at risk for suicide. It's another thing entirely to say, and here are the steps you can take right now to make a difference. Here's their PAC team. Here's the care coordinator you want to speak to. And then actually behind that, we're actually creating the process flows those workflows themselves are being modeled so that we have a closed loop system of escalation for that patient. And that approach transcends everything, right? Like we can do that for telehealth, we can do that for the point of care. It can happen in a digital twin, Gary. Like there's just a lot of different ways to approach that, and the modalities are sort of endless. And we can meet the patient wherever they might be. So the actual monitoring systems itself can go all the way into home care.
Yes, fascinating use case and excellent use of the technology, and a very important topic here. We're going to roll it up to priorities. Ryan, I'm going to start with you. Number one priority. No, it's tough. You have a lot of things going on in your office. Give us your number one priority for this year.
Oh my gosh. You didn't tell me you were going to ask me that question. That's so hard. I would say the number one priority, because it extends to all the other priorities, is health IT alignment across HHS, because that really makes sure that we are all rowing in the same direction and leveraging all the great work happening by the smartest people in the respective rooms across the department. So that is something that you can read about on our website, but it just basically ensures that all the standards are being adopted and harmonized consistently in all the programs that are federally funded across the government.
Critical aspect, and we appreciate the focus there. Carl, a lot of activity going on over there at the CIO's office. What is your number one priority for this year?
Given my other comments, you might think I'm going to say data, but that's not it. The number one priority for us is clear cut. We're the sector risk management agency for the nation's healthcare critical infrastructure. And myself and my colleagues at HHS work on the cybersecurity of that healthcare infrastructure. So if I could do a quick plug, for those of you who are healthcare practitioners or hospitals, go to 405d.hhs.gov. That's 405delta.hhs.gov. That will describe an industry government partnership where we will assist you with best practices for cybersecurity across the healthcare infrastructure. In the last fiscal year, the healthcare industry was the number one target for ransomware attacks. We are looking for ways to help prevent those attacks, mitigate them when they happen, and provide assistance to the healthcare industry.
Very, very important aspect, and we really do appreciate you highlighting that. Dr. Evans, number one priority for you as the acting program executive director of the electronic health record modernization.
Yeah, I think absolutely. I would say there's a lot going on, and it's always hard, as you point out, to name a number one priority. I'll say our number one clinical priority is always suicide prevention, and I appreciated Ben's comments around the Mission Daybreak work. A lot of work happening there. But with regard to electronic health record modernization, I think our number one priority really is we're moving forward to do a deployment at the James A. Lovell Federal Healthcare Center in North Chicago. This is a fully joint VA and DoD facility. We're looking forward to deploy the modern electronic health record, the federal electronic health record, at that facility in March of 2024. And it's really an example of a place where a common federal record makes an incredible amount of sense at a site that is both a Navy base that processes more than 40,000 naval recruits per year as they enter the Navy, as well as a VA hospital providing a full set of services to both veterans and beneficiaries of the Department of Defense's healthcare system. Really exciting project and top priority as we move forward over the course of this year.
Appreciate that, and we look forward to seeing that evolve in 2024. What we're going to have to wrap it up and with the show here. I always like to end with this last question. I'm going to start with you, Ben. And what we want to talk about is, let's fast forward a couple years. What's it going to look like for Red Hat? What's the demand signal that you all are seeing that you'll be focusing on 2 to 3 years from now for this very important community?
I would say automation just everywhere. So automation in practice, the use of AI for automation, just to what Carl talked about with 405D, the automation of security controls. That's something I'm actually working on right now, creating playbooks to automate the compliance for health IT systems, where you just run an automated script and it goes through and does all the controls for you. I think that is really the future. It's happening in every industry, and healthcare is not being spared.
Fully automated type of capability. We look forward to that. Frank, as these bad actors get much more sophisticated and these environments get much more sophisticated, what can we expect 2 to 3 years from now?
Well, the U.S. Federal government's number one cybersecurity initiative is zero trust and implementing zero trust. So hopefully a few years from now, we're well down that path, leveraging things like Carl pointed out around 405D, and zero trust is the most important synonym there is continuous, constant, continuously authenticate users once they're granted access, continuously monitor critical systems. And let's make sure that we're absolutely locking down probably the most popular authentication device, the handheld, growing amount of PPI, PHI authentication device needs to have the same cybersecurity rigor, that other more pieces of your critical infrastructure do. And then we're really on that path, Luke, of locking down handheld to cloud, especially as the volume and velocity in the attack surface and the criminal element continues to expand and get much more complicated and sophisticated.
Really look forward to that, and we really do appreciate all that you're doing. Gary, you talked about 5G. We've talked about geofencing, et cetera. 2 to 3 years from now, is that just going to be, completely ubiquitous out there? Are we going to be talking about 6G at that point? What can we expect 2 to 3 years from now?
Yeah, right. Well, every year there's a new buzzword in healthcare, right? We've kind of shifted from this connected hospital of the future to more of this connected ecosystem. And so that's really what we're focused on. We're looking at this as an ecosystem, right? We're working, if you're familiar with all the millimeter wave, the spectrum bands that we had purchased from the government, we're focused on, expanding 5G, into more rural settings, so that we can do things like, my parents who ended their lives, after month stays in a hospital could end their lives in the home. So just better connectivity at home, more devices. We're using computer vision to evaluate patients, right? Look at changes in respiratory patterns. Hey, this patient might be in arrhythmia, or even to identify patients who might have COVID, just the way that they're breathing, or the fall detection, to alert clinicians. So I think what I'm most excited about is just more ability for care at the home. And then access, and certainly growing up in naval hospitals, I know about the challenge of access, right, within those institutions. And so we're doing a lot around like kiosks. Imagine a kiosk that's more than just a blood pressure cuff, but actually has telehealth ability built into it. Dr. Evans talked about the Affordable Connectivity Program, as did I. Imagine this kiosk where you could fill out, applications for Medicaid, for a hospital's charity program, whatever, what have you, medication lockers. So, and putting these in grocery stores, putting these in areas where people frequent. So that's going to be exciting to help improve access to our healthcare system.
And we certainly look forward to that and appreciate everything that you're doing. Dr. Evans, a lot of activity going on over there at the VA. Let's fast forward 2 to 3 years. What are we going to see 2 to 3 years from now? What's the focus?
I think, look, this is a panel about health information technology, and we are going to see continual improvements in health information technology over 2 to 3 years. And I think it's important that we're focused on what the purposes of those improvements are, right? They're about empowering clinicians and veterans. This is from the perspective of VA, allowing both the clinician and veterans to be engaged in the tasks that they need to, and connecting them. In many ways, as health IT gets better and better, it gets more and more out of the way of what is at the heart of healthcare, which is a relationship between a healthcare provider and a healthcare system, and the patients that they're serving. So I'm excited about seeing, for example, how as we introduce, for example, AI type technologies into clinical workflows, how does this improve and lessen provider burnout across the healthcare ecosystem? How does it allow veterans or patients in general to feel more connected and to be able to get connected to the right services that they need faster? I think we're going to see a lot of growth over the next 3 to 5 years. And it's going to be the real challenge here is to take the new technologies and figure out how to best implement them in the context of our healthcare systems.
Turn it into sort of the ultimate easy button, if you will. And we really do appreciate you enabling those capabilities to the veterans and across the various communities. So thank you very much for that. Carl, you talked about a lot of different activities going on over there at the HHS offices. 2 to 3 years from now, what would you expect to see? What are you aiming for to ensure happens there?
I think what will drive us is that the volume of data will be so large that we're going to have to develop AI techniques so that they can parse and use that information. And what I'm looking at is, call it the trusted advisor, not the decision maker, but the trusted advisor to the practitioner, provider for diagnosing patients, for spotting trends, for things like, an HHS agency like the CDC or the FDA, assisting the senior decision makers within the department with understanding where we should allocate resources. The journey there, though, we have to be careful, because if we're going to use AI for those types of purposes, it must be trustworthy. It must be accurate. There's no room for, the term is hallucinations that the current AI systems can sometimes do. There's no room for that in healthcare. It has to be accurate, and it has to account for diversity. It can't skew results because of biased data or algorithms. But I do think we're going to see a lot of promise there. This is how we're going to use all this data I've been talking about.
Through the use of these advanced technologies, and we certainly do appreciate that. Look forward to that as well. Ryan, you talked about a lot of very significant and comprehensive national issues there. If you were to fast forward 2 to 3 years from now, what are you expecting to see?
So I'm expecting to see, in addition to, I would just agree to everything my other fellow panelists have stated, but I expect to see, and I will do whatever I can as long as I'm in government to make this happen, that we work more as a united team across the country, no matter whether we are inside government or in the private sector, to make sure that we are addressing, whether it's a cybersecurity issue, a diversity and equity issue, or just a delivery of care issue, that we do more to leverage our findings and shared resources and intellectual property, if you will, as a collective kind of team to continue to innovate and to continue to deliver the best solutions possible. Because I think what people miss a lot is that if we don't have that strong foundation in place, we will continue to have national security threats and problems that don't need to be the top concern and priority. We can do better for ourselves and for our country, no matter who we're trying to serve. So that's my hope and expectation. Thanks.
And I'm confident that you'll achieve that, and I'm confident that all of you will achieve everything you've described here. Fascinating, and we really do appreciate it. So I want to thank you all for taking the time out of your busy schedules to join us on this program and impart this information out that is so very important. I'd like to thank our sponsors for supporting us on this show. I'd like to thank the good people here at Federal News Network that make this program so successful and enjoyable. And most of all, I'd like to thank the listening audience out there that tune in every month. You've been listening to the Federal Executive Forum, part of the Federal News Network.